Well, did you know cancer can be a big problem for your pooch? Dr. Chris McReynolds from Southern Colorado Veterinary Internal Medicine is here to tell us a little bit about canine cancer, also Karen Waldorf, and Fenris. Okay, not even close. Who was a little cancer victim here, or survivor, should I say.
We like cancer survivors.
Yes.
And fighter.
Well, Chris, first tell me, how common is canine cancer?
It's actually more common than you'd think. 1 in 3 dogs actually is affected by cancer.
And how treatable is it?
You know, that's the fortunate thing. Each year we get better and better at it. But the treatment in cancer, many of the cancers are very treatable, but not at the expense of quality of life. We want to maximize quality of life while we're treating these patients, and I think we do a very good job.
Okay, and there are awful side effects for humans with things like chemotherapy and radiation. Right. How do the dogs respond?
Thankfully, because of the way that we do the treatments, where we do lower doses, extend the frequency out, only 1 in 4 dogs actually shows side effects with their treatment. And there's a study that was done at University of Pennsylvania that showed out of most owners felt that the quality of life of their patient or their pet going through treatment was 9 out of 10. They felt that was a good quality of life. So
well, good.
I think we do a good job.
And Karen, tell me a little bit about your experience. What's it like to be a caregiver of a dog with cancer?
Well, as Dr. McReynolds mentioned, Fenris has been treated with the intent of maintaining his quality of life. So when we started this process over 2 years ago, he really only had a handful of days where he was visibly upset and unhappy and under the weather. And since then, he's really been fine. Okay,
and how pricey are these treatments?
Very pricey,
yeah.
But I would say that every day that we get to spend with Fenris and the fact that we've had over 2 years with him has been worth every dollar.
Okay, and you said some pet insurances cover cover the treatments to some degree?
Yeah, and I think the other thing I would mention is that there are a lot of treatment options, and Karen and PJ chose to do the higher end treatment. But I think what was really nice to know is Fenris's prognosis was probably days to a couple months without treatment. And now we're looking at a 2-year anniversary as of this summer, and he's still doing quite well. So,
nice.
You know, so sometimes you can't put a dollar on that.
That's so true. I mean, we would do anything for our little family members. Lastly, how can we recognize the development of cancer in our pets?
Excellent question. And I think just think of them as 4-legged us. Making sure that you do your regular checkups. Annual exams are imperative. We like to call them wellness exams because dogs and cats age a lot quicker than us. Once they get to 10 years of age, I recommend that you see your veterinarian about every 6 months. And then, just like we should be doing routine examinations, we should just take think of it as a pet massage. Start at the top, go down to the tail, and just if there's any lumps or bumps you feel, just make sure your veterinarian's aware of it.
Okay. Fenris, I bet you love those pet massages, huh?
He does.
Thank you guys so much for telling your story. I appreciate it.
Thank you.
Thanks.